Ever wondered what a nuclear stress test is and how it's performed? Well, today we're diving into the details. A nuclear stress test, also known as myocardial perfusion imaging, is a procedure that reveals how well the heart is functioning. The test uses a small amount of radioactive substance in conjunction with exercise to achieve this. Before we delve into the process, it's crucial to understand that there are two types of nuclear stress tests: the one-day test and the two-day test. Both are performed using a similar protocol known as the Bruce protocol, but their duration differs. For the one-day nuclear stress test, the process begins with an injection of a radioactive substance, usually thallium or technetium, into the patient's bloodstream. The substance travels to the heart and is absorbed by the healthy heart muscle. After the injection, the patient waits for about 15 to 60 minutes to allow proper circulation of the substance. Following this, the patient is placed under a gamma camera that captures images of the heart at rest. These images serve as a baseline for comparison. The exercise phase then commences. The patient starts walking on a treadmill, gradually increasing the speed and incline according to the Bruce protocol. As the intensity of the exercise escalates, so does the heart's demand for blood. The radioactive substance in the bloodstream shows up more in the areas where blood flow is adequate and less in areas where it's not, revealing any potential blockages or reduced blood flow. Once the patient reaches the peak exercise level, a second set of images is captured. These images are then compared with the resting images to identify any discrepancies. The two-day nuclear stress test follows a similar procedure. However, the resting and stress parts of the test are done on separate days, allowing for a higher dose of the radioactive substance to be used, which can provide clearer images. Preparing for a nuclear stress test is straightforward. Patients are usually asked to avoid eating, drinking caffeinated beverages, or smoking for a few hours before the test. Certain medications may also need to be stopped with the guidance of a healthcare provider. In summary, a nuclear stress test is a valuable tool that helps doctors assess the heart's condition by comparing images taken at rest and peak exercise. Whether it's a one-day or two-day test, the process involves the injection of a radioactive substance, exercise on a treadmill, and capturing images under a gamma camera. Remember, it's a safe procedure, and the radioactive substance used leaves the body within a day or so. Preparing for the test involves simple steps, but always consult your healthcare provider for specific instructions. That's it for today's topic. Keep exploring and stay curious.